Hi, in this video today, I'm going to be taking you through the jobs you could work in when you arrive Canada as a healthcare professional from different parts of the world. So if you are in a healthcare profession, nurses, doctors, pharmacists, optometrists, I'm going to be taking you through different jobs you can find yourself in and do well. There is what is called transferable skills, that you can transfer your skills from what you are currently working in your home country to that job, and you'll be taking when you arrive in Canada. Why am I doing this? A lot of people have said most times when you come to Canada, you are left to doing a care job or you are a taxi driver. I'm here to tell you that it is not true. There are many other jobs you could do while you wait your licensure or while you wait your certification to start your practice here in Canada. And I'm also going to talk about the certifications you need that you can start preparing from your home country. Some of these certifications you can even get online before you arrive in Canada, and that makes your life easy because when you're making application, you already have the certifications. The people, you will not have time to go and say, okay, or your employer will not have time to tell you go and do another certification. It means you already have it and you have upper hands when you apply with other people. And I'm also going to talk about the entry requirements you need for these courses. And that takes me to, if you're a returning subscriber, thank you. And if you're just coming across my channel for the first time, please subscribe. Put on the notification button because most of my videos are time sensitive, so that once I upload, you'll be able to get it. And let's go straight into what we have today, which is the jobs that you can do when you arrive Canada. So healthcare related jobs are what I'm going to be discussing. And in this healthcare related job, I'm going to be talking about the clinical assistant roles, the ones that are not licensed, because there are licensed ones. So the non-licensed ones are the ones you could do. I'm going to give you example by the time I go through these 5 bullet points. Then I'll take you through the examples under them. You have the research and laboratory jobs. In fact, this was one of the jobs I took up when I came to Canada. You have the administrative and policy roles that you can do. Then you have the education and public health. So those of us that like talking and those of us that know how to impact knowledge, there may be organizing campaigns or being able to talk to the public. This is where you can fit in very well. And there are other related jobs or other related fields that you could actually work on. While we go through this video, you understand all these things I'm saying. And if you have any question, you could drop it in the comment section. So the clinical assistant roles, non-licensed, emphasis on non-licensed because there are licensed ones. You have the clinical assistant or the clinical associate. Like there are provincial programs like Alberta CA, clinical assistant, that you could do that will help you. What do you do in this role? You work under supervision of a licensed physician. That's basically what this role is about. Then you have the physician assistants that require certification in Canada. So in this, you need a certification. You need to have gotten your MCCQ1 for you to be able to do this, or any other certification depending on what the province you are in want. Then you have the medical office assistant or clinical office assistant. They support administrative and minor clinical tasks in clinics and hospitals. So you could take up this role while you are actually trying to do your certification exam or your licensure. You can take up this role. Then you have the personal support worker or healthcare aide. You assist with personal care, often in long-term care or home settings. This is one of the jobs that most people think this is the only job that doctors do. Is the emphasis on doctors because they just keep singing it into doctors' ears so that it will discourage you from migrating. This is me telling you there are other jobs you could do aside the personal support worker. But personal support worker is also an option if you're someone that like care job. Then you have the developmental support worker. This developmental support worker is actually a job that's to tell you that if you're in need, you can still get your permanent residency. And what do? You support individuals with developmental disabilities, autism, Down syndrome. And if you're a nurse, most times they take nurses often. So you're not limited to just being a home support worker. There are other jobs that you could do, and these are the ones that are under clinical assistant role. We also have the research and laboratory jobs. If you're someone that loves research like me, you can work as a clinical research assistant or coordinator. You'll be involved in medical or pharmaceutical research trials, different ones that you will even be enjoying your experience there because you are kind of still working amongst your colleagues. Or you can work as a research assistant or research associate. So you can work in the university, hospital-based roles in health sciences or public health. You could take up these roles. And the thing about this is something that you can actually modify your CV, bring out your transferable skills, and transfer it into the role you are applying. This is where I come in. If you need help with your CV modification, you can book a one-on-one with me. I will help you go revamp your CV and fit into any of these roles that you want. Then you have the laboratory technician and technologist. This may require certification depending on the province. Then you also have the health informatics specialist. They work with health data, often in hospitals or public health settings. And as a doctor, you already know that you should keep high level of confidentiality. Nurses, you keep high level of confidence. If you're in the health sector, you should keep high level of what? Confidentiality. So make sure that when you're applying for this role, that should be singing or ringing in your head that there is what? Confidentiality factor here, which is something that you are already used to as a healthcare professional. Then you have the administrative and policy roles. I love policy so much. Then this is what? Health program coordinator. You could coordinate projects, you could manage projects. And this one, if you are interested in this role, you can actually get a project management from Coursera, project management from LinkedIn certificate. That's project management certification. You can get it and you can use it and apply in different NGOs, and you will get a job as a doctor, and you'll be working in this role, being paid well while you wait for your licensure. Or if you're a nurse, while you wait for your licensure, pharmacist, optometrist, whichever health profession that you are in, this is a role that you can take up, provided you do the project management certification. Or some may not even ask you, they will just be interested in your transferable skills. So if you've coordinated programs back home, someone like me that coordinated different medical outreaches, this transferable skill was something that sold me so well. So if you're someone that is able to coordinate programs and they are successful, this is a place for you to venture in, pending when your licensure is ready. Then you can do a medical interpreter. I still interpret. So it's a cultural mediator where you can actually help speak Igbo for those that are not able to understand English. This is just like an interpretation role if you want to, especially if you're bilingual. That gives you an opportunity to leverage that. Then you have the health record technicians or medical transcriptionists. Medical terms now you can transcribe. Once you've gone through any of the medical schools, you should be able to transcribe as a nurse, as a pharmacist, a lab technician. You should be able to do some level of transcription. Then case manager or client navigator, you assist patients navigating healthcare system. These are things you can just sit in your office and you are doing it without any issue. Then you have the what? Occupational health and safety officer. If I, especially me, I had a master's in occupational health and safety. So anything you need in this role, you do not even need a master's in occupational health and safety to work in this role, provided you have the relevant training. You can do the safety training. Some of these certifications, you can get them online. That brings me to telling you what, you can start these things from home if you know you're coming into Canada, so that you get all these hands-on certifications while you are trying to get your licensure to practice. You will still have a good job that you are doing, so that you will not be under so much financial constraints. So you have we move on to the education and public health. The health educator or community health worker. If you did community health, you understand what is the community entry and all those. If you have the experience of this, you should be able to work in this. The only thing they are looking out for what is the transferable skills from what you are coming from. And when you modify your CV and you bring out all your transferable skills from the different places you've worked, they will see that, okay, you can do this job. And that makes you what? An asset to the organization. And you should also be able to prove to them during interview that you are an asset, because if you cannot prove what you say you are, how do you want me to hire you? That's what thing I always tell people. I say, if I am coming for an interview, I usually prepare myself very well. You know why? Because so that any question you are asking me, I am giving you what answers with evidence, with certifications, and with proofs. If there is anything I've done, I will tell you, I will explain it, and tell you how I did it. So this is how to prepare yourself. Then you can do a public health analyst or program officer. You can do this. Then you can do teaching assistant or lecturer in health sciences, especially if you have a master's or a PhD already. Most doctors, nurses, some of them have masters and PhD, even pharmacists. So you can actually apply for these roles instead of bending or being in that fear of, hey, is it care that I'm going to be doing there? That's abuse of status for some people. But the thing is, you can start from somewhere. Then you can be vaccination and screening program staff. During COVID, so many doctors worked in this COVID, in this kind of situation, or in this in this role, and they survived and they were happy. Some of them were paid as high as even $35. So it's something that you should stop limiting yourself because they told you it's only health, is only home care or a taxi driver that you could do when you come to Canada. There are many other things you could do as a health professional when you come to Canada. It's not only home care. Then that takes us to other related fields that you could work in. You could work as a medical writer. They call it a medical scribe. So you could work as a medical scribe. I know someone that read physiotherapy back in Nigeria that was working as a medical scribe. What do? You help doctors write when they are talking. So when they are talking, you are writing, which means you're going to be very conversant with medical terms and medical and prescription, so that if the doctor is saying anyone, you are writing it down. And if you do not understand anyone, you should be fast enough to jot it down, so that after seeing the patient, you could ask the doctor questions, then update any of the things that you missed. Then pharmaceutical sales representative. So if you're a pharmacist, why can't you ask to be a sales rep? Because you still do it back home. So why can't you ask to be doing that here? And if you're good in sales, you will do well. Then you have insurance or medical consultant or case reviewer. So there are many things you could do. The things I listed here are not exhaustive, but this is for me to do what? Clear that cobweb that people put over your eyes or in your head, saying these are the only jobs you could do, a taxi driver or home support. No. You can do medical coding and billing specialist. You see, as a doctor, your IQ is so high, or as a health professional, that you know that you are the one that really wanted this. Your IQ is usually very high, so you can adapt. Be willing to adapt while you wait for your what? Licensure or your certification to go into practice of what you want. So this is something that you can actually do by yourself. Then that brings me to the entry requirements and helpful certification. You can do the privacy training, and the privacy training requires that you get the Personal Health Information Protection and Electronic Document Act. So when you do this is specifically for what? For the Canada wide. When you get this, you can work anywhere in Canada and even for private sectors. The purpose of this is because it's used to regulate how businesses handle personal information. Emphasis on personal information. Why am I emphasizing this? You can see it's bold. Emphasis of personal information in the course of what? Commercial activities. So that you won't be selling out people's information for scammers to be using. That's why this is important. It applies to banks, telecoms, insurance companies, and any private business that collects personal data. You can see even people that sell online. So it means you can actually work anywhere if you get this certification. You see that? Then you have the Personal Health Information Act, and this jurisdiction is for Ontario provincial law. So when you get is to how to handle what? Personal health information. For those of us that work in the health sector, you know what it means to handle personal health information. Is something that is very, very confidential, except only on legal reasons, and that's with even a court order that you can release it. So it's something that if you want, you need to get this Personal Health Information Protection Act for you to work there. And these are certifications you can actually do online, pay for them and do them online. Then you have the CHIM or HIM for health information management rules that you can actually also get. You have LinkedIn learning. All these things, most of these in project management, some of these courses, you can get them on LinkedIn learning or Coursera, and then Canada Institute of Health Information Training for digital health. Are you seeing all these things I'm mentioning? They are things you can get online. So if you're already priming yourself that you're coming to Canada, you should look out for these courses, do them, pack them. If I tell you all the courses I did online before coming to Canada, you will not even believe it. Then you can do first aid and CPR. You could do the online one. Then if you come into Canada, you now do the physical one. And these are things that you can do. Then also gain volunteer experiences, volunteer for Red Cross, volunteer for hospitals, volunteer for home, volunteer for different things. That makes you what, stand out from the crowd. And these are things that when you are presenting yourself, or when you are talking about yourself, saying this is the reason why an employer should take you, they will be looking at you and say, yes, this candidate, we really need to take this person. So be able to have those things that will make you stand out. And that's the major reason why I am making this. And if you need help with your CV modification to fit in into any of this role, that's where I come in. You can contact me directly for that. Then all things are possible to them that believe. If you believe this is possible, you will get it. But if you believe it's impossible, I don't know why you are believing that it's impossible. All things are possible to them that believe. And if this made sense to you, you can invite your friends. And remember to subscribe, share, and like my video. Drop your comments and I will sincerely respond to them. So have a nice day. Thank you for watching.